Hello, everybody. We are going to perform blood prime. Okay. So for the blood prime, you are going to um, set up your machine like usual. For the arterial line, they connected a spike, an accessory spike, where you're gonna spike the blood line to the unit of blood, and the venous blood line or the return line. You're gonna connect it to an accessory spike to an effluent bag. But take note, this spike from the effluent bag is tied so that there is no wastage of blood. It will not spill out. Okay? All right. Okay, so Miss Nanep is going to spike. Hold on, before we do anything, the machine is gonna tell you what kind of prime you're gonna do, RBC, how much unit is in your, how much percentage of hematocrit from the blood bank. It's 60, and your maximum flow rate, well, yeah, that's good, and it wants it to be 300. Anything under 300, it's not gonna like it. Press confirm, and steps from left to right starts with connecting inlet line. Okay, so she did that already. And connect the return bag to the empty bag. That's which she did that already. Number 3 is unclamp the line, so you're gonna unclamp the return line. And then also, you unclamp the arterial line? Yes, you did. Okay. Start custom prime. Yeah. So it's now priming. Okay. Take note that when you're doing custom prime, you want to make sure that you also see the bag of the unit of the blood, so that you don't run out of blood, because your biggest problem is if you run out of blood, you don't want air. Yeah. So yeah. So this setup holds 185 ml of volume. That's in your priming volume. And 1 unit of blood is about 350, 300. So it's more than enough to prime this with blood. Yes, with a little bit left over. So I like to stop at around 200 ml. That way you've primed the whole setup plus a little extra, and not running out of blood from the unit of blood. This one here catches it's a collection bag. So the saline prime from the setup that you have primed it initially is going to dump here until all of your lines have blood. Okay? Yes. So the purpose of blood prime is to make sure that when we're starting your treatment, we're not reducing your blood count by taking it out of your body and then giving you saline. So we're trying to prevent an undue anemia or blood loss. Yeah. So if the volume of this one is more than 10% of your current blood volume, then that might cause some kind of blood loss, and we don't want that. So that's why the machine is so smart in calculating and saying, would you like a blood prime? It's a specific case. Yeah. Machine. Yeah. Based on the hematocrit. Yeah.
But can you not follow the recommendation of the machine? Can you go ahead with priming albumin instead of blood?
Now, the albumin specifically, especially for your hypovolemic patients. Yes, but blood prime is for your patients with low hematocrit. Yeah, so there's specific reasons why a certain custom prime is recommended. Yeah. All right. So as you can see here, so we're gonna say end custom prime, and you're gonna say end custom prime, and then confirm. So it's kind of tricky. You got continue and cancel. The verbiage on this is a little tricky. If you say continue, I will show you what's gonna happen. It's gonna go back to custom prime. So we're gonna say end custom prime, confirm, and choose cancel. Okay, so remember, choose cancel. This is the tricky part. All right, so cancel. All right, so now it shows you the screen where you're going to spike your replacement bag, and you're now ready to start your treatment. Yeah, so my suggestion, it is good that she put tego caps here so that when she disconnects, it's not gonna cause any
Mhm.
spillage. Just take note that these are your end lines that will connect to the patient, so remember to maintain sterility. Okay. All right, so Nanette is now starting the treatment.